Hi viewers, welcome to my Life One channel. I am Dr. Anwar Hossain. In this video, I will tell you about the hemorrhage. This video includes definition, types, characteristics of different types of hemorrhage, and the WHO scale for measuring the severity of hemorrhage, common sites of hemorrhage. So let's start. First of all, the definition of hemorrhage. Hemorrhage is defined as escape of blood from the blood vessels to the exterior due to damage or injury in vasculature. Now the types of hemorrhage. Depending upon the nature of vessels, arterial hemorrhage, venous hemorrhage, and capillary hemorrhage. Now, depending upon the timing of hemorrhage, hemorrhage can be classified as primary hemorrhage, occurs at the time of surgery or trauma, reactionary or intermediate hemorrhage, it occurs within 24 hours, usually 4 to 6 hours of primary hemorrhage, causes slipping of ligature, dislodgement of clot, cessation of the reflex vasospasm. Now the secondary hemorrhage occurs after 7 to 14 days of primary hemorrhage due to infection, sloughing out of the arterial wall. Classification of hemorrhage depending upon the mode of onset. It may be classified as acute hemorrhage and chronic hemorrhage. Acute hemorrhage causes due to injury, bleeding during operation. And the chronic hemorrhage, it causes hemorrhoids such as hemorrhoids, bleeding peptic ulcers, and menorrhagia, cancer, etc. Classification of hemorrhage depending upon the nature of bleeding, such as external hemorrhage and internal hemorrhage. External hemorrhage such as epistaxis, skin cut, etc. Internal hemorrhage such as rupture of spleen, liver, etc. Now the WHO or World Health Organization scale for measure the severity of bleeding. It is classified as grade 0 to grade 4. Grade 0, no bleeding. Grade 1, petechial bleeding. Grade 2, mild but clinically significant blood loss. Grade 3, gross blood loss requires transfusion and it is severe. Grade 4, debilitating blood loss, retinal or cerebral blood loss associated with fatality. Now the common sites of hemorrhage, such as mouth, causes after tooth extraction from extraction socket, and every dentist must face this hemorrhage. Hemorrhage may be occur from mouth due to gum bleeding, hematemesis, and hemoptysis. Bleeding from anus due to hematochezia maligna. Bleeding from urinary tract due to hematuria. Upper head, cerebral hemorrhage, subarachnoid hemorrhage, intracranial hemorrhage. Bleeding from lung such as pulmonary hemorrhage due to lung cancer or other causes. Vaginal bleeding due to postpartum hemorrhage, breakthrough hemorrhage, ovarian hemorrhage, and gastrointestinal hemorrhage due to bleeding peptic ulcer or other cause. Now, bleeding due to maxillofacial trauma. And nowadays, road traffic accidents are increasing every day, and for that, maxillofacial trauma also increasing. So, bleeding from maxillofacial trauma is very common nowadays. It is due to skin and soft tissue injury, vascular injury, for example, injury to facial artery, greater palatine artery, sublingual artery, maxillary artery, superficial temporal artery, external carotid artery, and Leafwood fractures and fracture of mandible. Thanks for watching the video. Please subscribe my channel for having update videos on different important topics.